as we know very well, for the longest time, we have not been able to achieve even most of the years, not even half of our blood supply. And that's why all the time we are looking for blood appeals. We are having families, we have friends, we are having relatives asking us to help them secure blood. So this is therefore an important component of that. So today we want to see how pre-donation testing and donor counseling can help us and what we can do, especially us in the laboratory. So by the end of this webinar, we need to describe the role of our role in pre-donation screening and testing. And we also need to explain donor eligibility criteria and deferral decisions. Then we need to be able to interpret key pre-donation processes, apply principles of ethics and effective donor counseling, appreciate the contribution of donor panel organizers to blood safety, and understand how integrated systems support a sustainable blood supply. So this is very, very important for us to understand. Okay, so now, why pre-donation testing matters? We realize that we need to protect donors because remember, donors, the best donor is a voluntary non-remunerated donor. And therefore, it is important to understand how this donor can come back. So before they come back, we need to be able to show that we can protect them. And that protection comes at this level where we are able to see how best to handle the donor. So pre-donation testing helps to prevent donor-related harm, especially in unsuitable donors. Remember, a donor who is not suitable should not donate or should not be seen to donate. Now, that has aspects whereby we need to appreciate that as someone is donating, you normally donate in a group or things like that. And this means that when now an unsuitable donor is seen to donate or to have donated, then it means that it will affect even the other donors. So, and at this juncture also, we need to understand that this unsuitable donor today could be a suitable donor tomorrow, and therefore preventing their harm today will help us to sustain a donor bank or a donor group that can help us tomorrow. The other part of this is that it helps to support long-term donor well-being and retention, which I've just mentioned. So retention is key, and protection or prevention of related harm, donation-related harm to the donor is key. The next thing that we need to understand is that pre-donation testing helps to ensure that the recipient is safe. How? By reducing risk of transfusion transmitted infections. Now, every time you do pre-donation testing and counseling, it means that you are able to weed out one by one, the donors who are risky. Then it also helps to avoid, now on the other side of the transfusion, the patient, it helps to avoid transfusion reactions. So all these are important components of pre-donation testing. And finally, I would say that pre-donation testing supports public confidence in blood services, because this means that we are able to be seen out there in the community, that we actually are able to do things. So the public confidence actually is reinforced, and the trust in our laboratory and the trust in our test results, and also the trust in the clinical systems that we also stand for is reinforced. We also understand that when we are able to do quality testing, pre-donation testing, then it demonstrates to the public that we are committed both to quality and safety. And that is very, very important in today's world where quality is something that cannot be gainsaid, where quality is something that everybody is talking about. Okay, so now for us to be able to do this, there are certain circumstances, there are certain things that we need to put into place. And one of the key components of making sure that donors come in and we have donors, and also one of the key elements of making sure that our donors actually are knowledgeable is when we are able to organize donor panels. So we need to be able to look into the fact that we can have donor panel organizers. Now, donor panel organizers are individuals in the community who are able to mobilize, coordinate, and educate donor groups. Now, this is something that is very dear to me because to my understanding, most of the times we do not engage donor panel organizers. These are individuals in the community. It's not the paramedics, it's not the medics, it is the community where you want to go and get probably a donor drive. So here, we are supposed to make sure that we have these donor panel organizers. These donor panel organizers are the ones who we train to talk to the people. So we give them basic training on how to talk to the people, and using their own methods and mechanisms, they're able to talk to donors, talk to donor groups, educate them, coordinate them, and even mobilize them so that when now we are having a blood donor drive, we actually have the numbers. The other thing is that we need to appreciate that donor panel organizers are the link between the community, our blood services, and our healthcare facilities. So if we do not form that link, we are always going to have an inadequate donor group, an inadequate donor pool. It is essential that we try our best to, at all times, not rely on ourselves, but rely on donor panels, donor panel organizers who are the link to the community. Now, so the donor panel organizers help or are geared towards pre-donation education and preparedness. This means that for us to have better donor drives, we need to make sure that the community is prepared for us. The community is educated for us. And that is the work of the donor panel organizers. And because they are able to provide in the language of the community, they're able to provide information on eligibility, information on how to manage donor expectations. So we need to manage donor expectations. At our level, we are not able to go into a community which is a community of farmers and manage the expectations. But the fellow farmers whom we have identified, who can now be able to talk to them in their farmer language, are able to actually help us out to make sure that we manage their expectations. So it is important that we are able to have this donor panel organizer. Now, they are the first checkpoint in donor safety chain. Remember that you need safe donors. Now, when we need safe donors, then it is the community is able to identify the safe donors. They are the ones who are going to tell you, no, this happens here, this happens here. In this position here, we know there's a lot of malaria. These guys here do not use a net, and all those things. So it is important for us to have them because they're able to identify potential risk factors in the community prior to even screening, and also because they are part of the community, they're able to encourage honest disclosure because the community knows them. So it is important for us to develop donor panel organizers. And lastly, donor panel organizers contribute to donor retention and trust. Why? Because one, they are in the community, therefore they are able to promote voluntary non-remunerated repeat donation because they come and they talk one-on-one with these people. They talk one-on-one with the donors and the donor groups, and therefore they're able to strengthen community confidence in blood collection programs and awareness. So it is important for us to have this first step towards donor safety, the donor safety chain, and indeed quality donation and improved blood donation and donor drives. Okay, so now that we have engaged our donor panel organizers and they have talked to the community, and we are now going to the next level of having our donor drive, then we need to do what we call donor selection criteria. We need to understand the donor selection criteria. So when these donors come, we need to be able to make sure that we have the age, the weight, and the hemoglobin requirements because we need to reassure and assure these donors that it is safe to donate. So when you check the age and the weight and the hemoglobin concentration requirements, then this helps us to ensure that the donor or the donation at that time meets the physiological suitability, and also this potentially is able to reduce donor anemia or hypotension. Okay, so other than that, we also know that donor selection criteria includes medical and surgical history. So when you're doing your questionnaire, we need to identify chronic illness or recent procedures that may pose risk, and also help to guide temporary or permanent deferral decisions when you're doing the donor selection criteria. So apart from there, and in our questionnaire, we also ascertain lifestyle and risk behavior assessment, where here we are able to assess exposure risk to transfusion-transmitted infections, and also to be able to see how best we can support confidential self-deferral when appropriate. Remember that at any one time, because donors are non-remunerated and voluntary, they are able, we must make sure that they are able to self-defer at any time and confidentially, so that when they are out there, nobody can say they did not donate or they did not donate because of ABCD. So it is critical for us to understand that when we are selecting donors, we need the confidentiality and all manner or aspects of donation that the donor requires for their confidentiality. So the key role of the laboratory in donor screening is verification of donor identity and samples. In the lab, we are able, or as laboratorians, we are tasked with a verification of donor identity and samples. And this normally, more often than not, prevents clerical and labeling errors, and also ensures traceability through the testing process. Remember, in all testing aspects, we are trained and very well trained. We are trained both at the institution, we are trained at the bench, we are trained during placements, we are trained during working, we are trained and trained and trained. So it is not easy to get technical errors. However, the majority of errors that we have are actually clerical and labeling errors. And this is common. So it is important for us to be there so that we are able to understand that, or to alleviate any clerical and labeling errors that may occur, especially when when testing is being done. Also, we need to appreciate that we are charged with performance of pre-donation tests, and this helps to confirm donor eligibility prior to collection and also act as critical safety checkpoints for donation for our patients. And last but not least, it is important for us to understand that for all the things that happen, the lab is charged with offering quality communication. And this quality communication includes communication of results. And these results must adhere to the timeliness, to the accuracy, so that the clinical teams are able to utilize the services that we offer as best as possible. Now, it is important for us to be able to support counseling and deferral decisions. These decisions occur or emanate from the information that we generate. So as we counsel, as we help counselors with their decisions, it is important that our decision, our results, our information is of quality and accurate. And that accuracy, therefore, helps us to give best deferral decisions. Okay, so one of the tests that we normally do is pre-donation hemoglobin testing. Here, it is one of the key tests that assesses donor suitability. And there is no point of having a donor who is anemic to give blood to an anemic person, because you create now two scenarios. The first scenario is that we are going to have an anemic donor whom we need to treat. And the second scenario is we are going to give a patient blood that is substandard. So those two scenarios are important to mitigate at the onset, and that is why it is important for us to do pre-donation hemoglobin testing. And wherever we are, we need to ascertain. Today, we have a lot of testing devices. It is important that these testing devices can be validated the best way possible so that we do not go back to our methods that we used to use, including copper sulfate and SALI methods, which are actually not accurate. So it is important for us to try our level best to use devices that have been validated and that give accurate, fast, and quick results for our hemoglobin estimation at the site. So when we have given this, when we have done these tests, again, the onus falls on us to interpret and follow up. And this takes me back to how we work in the lab. Do we have our normal ranges? Do we have our population, wherever we are, at heart, in such that we can be able to say, in my locality, the hemoglobin levels are this range for male, this range for female. Because you can even have normals of 11, because you are the highest the people around you are going are 15. So are we not going to have blood? Yet in this population, the highest I've ever gotten is 15.8. It never goes, no male has ever gone up to 16 or 17. So it means that therefore that the range for my population is this, and they are living with it, and therefore we can safely say that the range is this. And therefore it is important for us to do interpretation and follow-up. This, therefore, is able to help us determine eligibility of a donor and deferral of a donor in case they do not meet the criteria or the standards that we have set at that time. And furthermore, as we do the testing, we are able also to trigger the counseling and referral where necessary. So this is critical for us to understand. Okay, so we have done our pre-donation screening, we have done our pre-donation testing, and now the next step is donor counseling. So donor counseling is an activity that supports donor understanding. And it is important that those who are doing the donor counseling, be it us, be it the clinical staff, must be able to explain results clearly and accurately. Now, clearly and accurately means this person must know what a result entails. And they must not beat around the bush so that the donor, the potential donor, is able to appreciate that indeed they are dealing with professionals. Now, when this is done, then it definitely will reduce anxiety and misconception. Remember, there is a lot of misconceptions, especially in our communities in Africa, about this voodoo magic. There are so many things that are misconceptions about blood. We even have people actually saying some of this blood is given to other vampires, they drink the blood. All those things have been said. Black magic is conducted on the blood, and this blood is given to I don't know who and who. So it is important for us to understand that those who are giving counseling are actually supporting donor understanding by reducing anxiety and misconceptions. The other aspect of donor counseling is ethical and confidential approach. Remember, anytime you are going to counsel someone, they must see in you or in us the ethics that govern their life, because ethically you are even where your outlook is actually ethical, your greetings are ethical. That way, then they get the confidence. And then, of course, after that, then they should not at any one time have breach of confidentiality. So this is key. So when you are doing your counseling, therefore, and to propagate ethical and confidential approaches, you need to respect donor dignity, you need to respect donor privacy, and above all, we need to strive to avoid blame, judgment, or stigma. One of the key areas that drives non-compliance or apathy towards donation is stigma. Stigma and blame judgment. These two actually drive a lot of the blood drive, or people not coming for blood drive. So it is important for us as counselors now to be able to make sure that this does not occur. Now, donor counseling is one of the key elements that helps in donor retention, because counseling gives or builds trust in the donor blood services. Without counseling, we cannot have trust. So we need to be able to make sure that the donors trust our services, the donor trust our processes, so that they can come back, so that when now we need blood, actually we can go to them. Now, with this, then we are able to encourage future safe donation where appropriate. And it is important that counselors know that the counseling is not just for now, but also for tomorrow, where we are able to say that we have these donors and we have the trust of these donors, and therefore, whenever we call, we will get donors. Okay, now, because of the fact that we live in communities, and because of the fact that our communities are not as enlightened as we would think, then it is important for us to also understand that for donor blood services, we need community counseling, a lot of community counseling. Community counseling is purposed to build general awareness of blood donation. Why should people donate? Is it safe? What are the myths? Can we debunk the myths? Can we reduce fear in the community as concerns blood donation? Is there any misinformation? Is blood being sold? Is my blood being sold? When I donate, am I selling my blood, or is this blood going to be sold to the next person? So those are some of the things that should not come at the donation table, but out there in the community, so that when the community knows and understands and appreciates this, then we can now go to the next level of calling them to donate. The next thing about community counseling is that it must be focused on collective responsibility. We must tell our community that, you see, for us to get well, it is a collective thing. For us to treat you, it is not the lab alone. It is not the clinician alone. It is not the nurse alone. It is all of us. Now, when this is put inside into the community domain and they understand, then they now know that we can actually say that blood donation is a collective responsibility. That when you give blood today, tomorrow it can be you, the other time it can be your child, and all that. So when now the community understands this, then we can now be able to get them to come and donate. Without a focus on collective responsibility, it is not possible for us to get the numbers that we need for voluntary non-remunerative donation. Community counseling involves education on eligibility and self-referral. So when we are going to the community and getting to the podium, even during a rally, even during a funeral, even during all those, during a chief's baraza, when you get to the podium, we need to expound on who is supposed to donate, who is not supposed to donate, and how donation promotes, and how we can promote self-screening before coming to donate. So it is essential that the education on eligibility and self-referral is actually out there in the community so that we have better, safe donors. Now, as we go to counsel the community, we will definitely manage stigma. When we manage stigma, it means that we'll then avoid targeting individuals based on risk. We'll also avoid normalizing we'll make sure that we normalize post-donation testing and such that this becomes a routine. So it is critical for us to understand that community counseling is one of the key roles of the donor panel organizers and health teams. When we are collaborating with the DPOs, donor panel organizers, then the community counseling reaches far and wide, and therefore it helps us to make sure that we have trusted community messengers and donation which is aligned to policy, and in this way then we can actually have better and safer donors and donation drives. Okay, so we cannot do individual donor pre-donation counseling if we have not done community. And this is a disconnect that I see, that we are going to the individual, but the community is not very well informed. I know that some of us try to inform the community, but still, to the best of my understanding, we are still lagging behind in community counseling. And that now brings us to individual donor pre-donation counseling. And here, this is a one-on-one engagement. And in this one-on-one engagement, it must be tailored on history, responses in the questionnaire, and at that time, we need to be able to clarify sensitive health information. We put ourselves out there in the shoes of the donor. and try our best to make sure that this donor understands what they are going through, understands what they are supposed to do, understands how things are going to work, and whether or not they are eligible. They can be eligible, they may not be eligible today, but we must make sure that if that deferral is a deferral of probably not permanent, then it means that we must make sure that this donor understands that and comes back and is able to willingly come back. At the individual level, we do risk assessment and we encourage exposure and disclosure. Here, when we look at the medical history and the risk behaviors, we need to do this confidentially. We need to show the donor or the potential donor that indeed we are safe to deal with. We are safe custodians of their information. And in that way, then we can confidently assess risk and confidently manage disclosure so that these donors can actually disclose to us so that we can now give the verdict on deferral or non-deferral or donation. So at this level also, we must understand that when we have gotten this person to donate, at that time we need to explain the donation process clearly and physically and psychologically prepare this donor for whatever would happen. It is important for us to notify the donor about all the risks that entail. And there's a notion that if you tell them, they may not want to donate, but we need that confidence. We need this donor to come today, tomorrow, and the next day. And that is why I started by elevating the issues in the community. Then you come to the individual. And when that happens, and when they come, indeed, these are people who are prepared to donate. So it is essential that you give them all the steps and prepare them both physically and psychologically, so that when you have a vasovagal attack, when you have something like a hematoma, they understand, they appreciate that these are things that can actually occur during this process. It is not in good taste for someone to see something happening that they did not, they were not prepared for. So that is why counseling is very, very important. Now, today, it is crucial, and we know all the laws that are around, and we know all the treaties that we have talked about and learned about, the Cartagenas and all that. We need also to have informed consent, because this is a process on somebody's body, and this therefore confirms voluntary participation and also ensures that the donor understands that testing and the use of donated blood, what that entails. So we need to tell them all that. Then finally, individual counseling is one of the key elements in protecting donor dignity, whereby, because it is a safe environment, a one-on-one engagement helps to maintain privacy, helps to show that indeed you are confidential, and helps to reinforce respect and trust to our profession. So it is important, therefore, that this one-on-one counseling is done in the best interest of the donor and in the best possible circumstances and facilities. So let us try to and strive to make sure that we are able to give such counseling today and in future. All right, so today we are talking about counseling, and we need to also look at post-donation counseling. And we're saying that post-donation counseling actually will address minor adverse reactions. So you don't just let someone donate and then they go. No, you address them. How? By post-donation counseling, where we address minor adverse reactions that either may have happened or could happen, so that when they happen, the donors understand, know, and appreciate. This also provides aftercare, advice, and reassurance, because you need to tell someone, also you need to ask someone where they are going, what they're going to do, and in that way, then you are going to now again reinforce the issues of not operating heavy machinery, and all those aspects of post-donation activities, so that they are aware. And post-donation counseling also is an important component of communicating deferrals, whereby the reasons for temporary or permanent deferrals can and are given at that time, and the frame of deferral is also given, so that as a safety decision. Remember, when you are deferring, it is safety net for both the patient and the donor. So all those safety considerations are supposed to be given here during the post-donation counseling. Now, one of the critical elements of post-donation counseling is maintaining donor engagement. Donors must be engaged at all times. So if we don't engage them, then they won't come back. So we need to encourage them to return. We need to preserve their confidence in the system. And this is where probably post-donation information systems actually come into play, like Damu Kenya, where the information of the donor is input, and any communication can actually be delivered directly to the donor, and the donor is able to appreciate that our systems are indeed working. This is key. Okay. Now, again, on post-donation counseling, we have counseling that regards positive results. Now, this is the elephant in the room that we need to manage. So this is one of the most sensitive elements of donation, and managing this can actually help us to be able to get even more donors, or it can actually derail the whole process. So it is important that as we do our counseling on TTIs, we use clear, non-stigmatizing language. That is key. And we also need to allow time for donors to question, and allow time for emotional response. You cannot hurry a donor. You cannot hurry a donor. You cannot tell them that the time is up. No, it is important for us to critically make sure that sensitive results are communicated properly and effectively with clear language, but non-stigmatizing. Okay, so we also need to do follow-up, referral and follow-up, whereby the step-by-step process of referral on how the donor can get more appropriate healthcare services is required at this level. So it is essential that we have our referral options at our fingertips, and also that these referral options are actually, because remember, these are donors. So actually these referral contacts, we should have them at any one given time. You should even be able to call ahead so that the donor knows that they are being taken care of. Because this is someone who volunteers to donate their blood. This is someone who volunteers to come to us with their blood. So it is essential that we give them the best possible service, whether or not they donated. And so finally, last but not least on this, we need to make sure that these donors on TTI reactive results are actually given psychological support. So social psychology support is very, very critical, and we should recognize that the test results, especially when they're reactive, have an emotional impact. And it is important for us to have empathy. At the same time, it is important for us to reassure our donors or potential donors that indeed certain of these things happen, and that is why these results are like that, and therefore these are the steps. This is what you can do, this is what you should not do, and all that in a language that is empathic and a language that is reassuring. Okay, so apart from that, we need to know and understand donor deferral management. Now, donor deferral management involves the fact that we can either temporarily or permanently defer somebody. And now, what are the parameters of deferral? It is important for us to ensure that we allow recovery or resolution of risk factors and support future donor return. So when you have temporary referral, we need to engage the donor further, not just on the material day, but when we have deferred them, we have to follow them up and make sure that we can actually tell them, now this is time, this time you can come back. For example, someone just took aspirin because of some pain, and that is the only thing that they did, or any other platelet, antiplatelet substance, or antibiotics. When they wash off, then we need to have contacted the donor and say, you know, you have washed off. Right now, you are actually eligible to donate. Can you come back? Because that sure gives them the motive to come and donate. But more often than not, when a donor is deferred, in our case, that's the end of it. For those who are anemic, we need to link them up with nutritional services and make sure that they follow up, and we follow up as a donor team, so that by the time they have done with this, probably in 6 months, 1 year, then we can tell them, I know you are now good, can you come back and we see if you can donate. So it is essential for us to maintain this information. Very critical for us. For permanent deferral, it is important that we protect the blood supply, because at the end of the day, the patient is our patient. It is also important for us to protect the donor, because at the end of the day, we do not want this seemingly healthy person to become our patient in no time. So it is critical for us to make sure that we are able to see when to do permanent deferrals. And this requires also clear explanation and documentation of the process that has been used to do this deferral. Critical to this then is record keeping, which ensures that donations deferral status is respected and also prevents inappropriate future donations. So remember, when you have a good record keeping or record management system, then we are able to see who was deferred and who was not. We are able to see, to identify those who are deferred permanently, those who are deferred temporarily, and therefore reach out to them if they are temporarily deferred, or when they come, or when they feel like they can donate, then we can go back to our records and say, you see, the situation is this one, and this one does not change, and therefore it is especially important for our donor to understand. When we do that, then we are able to actually attract even more faith and ambassadors out there who can say, you know, the blood donation services, blood donation process is actually a very good process. So it is important for us to make sure that we do our record keeping the best way possible. So quality is the bane of laboratory services. And This slide here is something that all of us understand, and I hope that all of us are able to follow and make sure that it works. Everything, every process must have a standard operating procedure. That cannot be gainsaid. And with that, then we need to develop internal and external quality control measures. So such that we are able to see what happens, what are the quality parameters that we need to emulate, who is doing it better. Because even in blood donor drives and donor services, there is still quality. There is still internal quality and external quality. You must compare yourself, if not with your colleagues in this country, but even with your colleagues outside of this country. What are they doing best? What are they doing better that we cannot emulate? What is it that they have that we do not have? And how do we mitigate the circumstances so that we have the best donor services in our country and also in our region and in our country? So with that, of course, we know that for you to have quality, then documentation and audit is a must. So it means that we need to produce the best result, the best documentation that can be traced and that can be audited. Of course, when we have good documentation and auditable documentation, then we cannot fear, we cannot run out when we are being regulated. So regulatory inspections are very normal when you have good documentation. So it is important for us to have this so that we can be able to support regulatory inspections. Okay, so now that we have had our donor, so how do we maintain a safe and sustainable blood supply? So we need to have what we refer to as an integrated donor pathway, where we have collaboration between donor panel organizers, clinicians, and MLS. Now, this ensures end-to-end safety because the DPOs will tell you these donors are safe, and the lab will tell you that indeed these donors are safe, and the clinician will now use these two end-to-end processes to ensure that they give the best donor services. Now, when you have integrated donor pathway, this reduces gaps, especially between recruitment, screening, and transfusion. Because when you have DPOs, it makes it easier to go and do a donor drive. Why? Because they already call you when they are ready. So it is not a matter of now us going and asking and pleading. It is the community now coming to us and saying, we are ready today, we are ready tomorrow, we can do the donor drives. So it is critical that we have this. Now, indeed, with that, then we can say that we now have safe donor retention because we have developed community counseling. We have developed individual counseling. We have people in the community who are helping us out, and we are also going out there to promote healthy repeat donors. And this actually minimizes donor harm and unnecessary referrals. So when you have an integrated pathway, we are able to say that we can therefore should have developed a safe and sustainable blood supply. So of course, that means that we must have efficient use of blood resources, and we will have fewer and suitable collections, therefore reduce wastage and also improve inventory, planning, and availability. So the role of the MLS professionals in blood supply is to translate laboratory findings into safety actions. is also to guide clinicians and donor teams through evidence-based decisions. Remember, we are the custodians of evidence in healthcare. You are the eye of the medical profession. So being the eye of the medical profession, it therefore means that you can actually guide safe decisions, which are evidence-based. So we must strive to reduce wastage. We must strive to make sure we plan our inventories properly so that we improve on availability of blood in our stores. Okay, so we cannot go away without talking about ethical and legal considerations. It is important that donor information is kept confidential. This enhances donor privacy, it protects it, it enhances their trust in us, and also it helps us to comply with data protection regulations. Remember, today we have the Data Regulation Act, which is essential. And you have seen even in courts, where courts have awarded massive penalties to those that are not adhering to the Data Protection Act. So it is important that we take that as a cue to make sure that we maintain confidentiality. Like our oath says that we have a duty to our patients. These are our subjects, these are our donors. We have a duty to them, and that duty includes protecting their privacy and ensuring they have trust in us. And key to this is that there must be informed consent and there must be autonomy. The person must voluntarily bring themselves to donate, and if they fear the needle, even if the blood has started going into the bag, you stop the donation. If they say no, it is no. So it is for us to understand that they are autonomous. Our donors are autonomous. They also need to be informed, well informed, and sign the confidentiality. They sign the informed consent sheet and form so that we are covered. And finally, as an ethical duty or consideration, there is duty of care. Duty of care here will balance between donor welfare and recipient safety. It means that the donor must be safe. At the same time, the recipient must get safe blood. So duty to care will guide us to make proper decisions. Proper decisions include, is the donor safe to donate? Is the donor blood safe to be transfused? So that kind of, or that element of activity is what must guide us as professionals to make sure that ethical and legal considerations are adhered to. Okay, so finally, we have our take-home message, and our take-home message today is that pre-donation testing is critical to donor and recipient safety. That donor counseling is a core laboratory responsibility. That donor panel organizers play a vital upstream role in donor safety. And finally, that integrated systems will strengthen sustainability and trust in our donations. Thank you, and let's have safe blood in our communities, and let our laboratory professionals be central to quality in donation and ethics. Thank you, ladies and gentlemen. Over to you, Fred.
Thank you, Wigina, for the very wonderful and able presentation. I think you have excellently done it. And I think our participants also, if you're able to follow through, we have been able to be abreast with some of these practices. And I can see a lot of reactions. Yes, you can send those flowers to Daktari here. I think he has done a very, very wonderful job. And Yeah, I can also see your compliments in the chat box. Thank you, everyone who has found time to compliment Helen Wanyama, Tunje Ruben, Abraham Lorogoi, all saying very nice presentation. Tobias Odongo, thank you, everyone. Thank you, Josephat, that was powerful. Faith Kataka, well articulated. Sahara Abdi, great presentation. Abigail Nyamoita, well executed. And all of you. Now, we are going to get a few questions or concerns. And if you want the mic, you can just raise your hand. I'll be able to unmute you and you can verbally react, either ask your question. And Fred, I can see your hand is up. And I'm hoping that you are in a background that is conducive. And you can go ahead to unmute and bring your thoughts or remarks. Fred Mose, just unmute.
Good evening.
Good evening.
Yeah. And first, I want to thank Dr. for a wonderful session he has taught us. And I had a few concerns. There is this question I had from one of our clients who was actually concerned whether is it possible for a donor to donate blood and being transfused the same day? So if Dr. can elaborate on that. And secondly, there is this, while back when we were in high school, then this, once a donor has donated, he was being given a soda and mkate. Maybe Dr. you can elaborate what's the use of that. Thank you.
Fred?
Yeah, thank you, Fred. Thank you, Fred. So, Dr. you can go ahead.
Okay. Mkate na soda. Now, when you donate blood, what happens is that the key element here is the fluid. So you have donated blood, and at that time you have impaired your body oxygen capacity. Now that can play around your brain to even make your brain shut down, and that is why sometimes you find people will faint. So it is essential, therefore, that the first thing the body does is fluid retention. So it is important for us to have as much fluid as possible so that the fluid in your body is we are able to regain the fluid as soon as possible. Okay, so the volume expansion is important. So either soda, because it is more palatable, or water, because you can drink as much as possible, or juice, you can drink as much as possible, so that the body is able to retain as much fluid as possible to compensate for the loss. Because we know that the HB will be gradually done. So when you give a soda and mkate, that is, the mkate is an incentive. But the soda is critical. So give us soda plus water as much as possible so that this person can be able to have some fluid that they can retain to take care of the fluid that we lost, the 500 ml or so that we lost. Another thing you asked is donate blood and transfuse the same day. The reason why the WHO recommends central blood donation services is so that we can have the highest standard of testing. The highest standard of testing requires that we also do quality check on our blood or on our batch of blood so that we can have the best quality of blood. So essentially this means that if someone is donating today, or okay, we can give that blood, but is it safe at that time? Is it safe to give? Has it been tested? Has it been quality tested? So how long does it take to quality test a batch? So that means, therefore, that at the minimum, you could take about 3 days. And that is why we advise that blood donations should be non-remunerated. Therefore, it means these family donors, we try as much as possible not to use family donors, but to use non-remunerated blood donors. Of course, we know that in our system today, there's a lot of family and relative donors, but for us to have a better say here, we need to have non-remunerated donors, and therefore, it could be safe if it is tested, but it is not advisable, according to me. Thank you.
Thank you, Dr. for that. I think that's quite clear. I think there's still
something I saw on the chat. I
yes,
just wanted to say, if you have polycythemia, if someone has polycythemia vera,
yes,
polycythemia vera, then that person could most likely be having other conditions, including AML. So you cannot transfuse such blood. There's a difference between erythrocytosis and polycythemia rubra vera. So let's be careful of how we are using the term polycythemia vera. Thank you.
I think that's clear. That's clear. And thank you, Fred, also for acknowledging the response. Thank you. I think there's another one here regarding high HB from Michael Osanya. What if the donor has high HB level and wanted to donate? Okay.
I think high HB, depending on the high, because if it is higher than the normal ranges in a region, then it means that it is suspect. Okay, so any you see, we are having the best best quality of care, the highest quality of care, meaning as the blood should be as safe as possible. And remember, I've already said that if it is higher, then it could be tending towards polycythemia. If it is tending towards polycythemia, then we have to be cautious in donating or giving this blood. The blood can be donated, but essentially, you must monitor this patient to the level that you understand that the high HB is not in any way related to a condition that could be malignant. Okay.
Thank you. Thank you, participants and colleagues. I don't know whether there is any other question, but I can see from Simon Changalwa. Why is it that people with tattoos are not eligible to donate, Dr.
The donor questionnaire is a live document. Live meaning that we cannot use yesterday's perceptions in today's world. So today we have monogamous homosexual men, okay, who do not have HIV or otherwise, because the perception previously was that. So should we allow them to donate? Today, everyone wants to do a tattoo. Previously, tattoos were the tattoo needle. Those ones were shared. Okay, so if they were shared, it means at that time, and it wasn't very safe to actually do a tattoo. So meaning people with tattoos ended up probably having TTIs. Okay, so today that we have very safe tattoos, okay, is it okay to defer them? So those are questions that we are posing to ask ourselves. So today, I think that depending on the donor, and that's why I introduced the element of donor panel organizers. The donor panel organizers will know who are these people. The tattoo, where can they have done the tattoo? And therefore, this donor is safe and they can donate. Fred?
Thank you for that. Thank you. And then, okay, there are a couple of more questions. I'll begin from Caroline Nyamwanda. Why is lipemic blood not accepted for transfusion? And then maybe I can just add this one from Nancy. You've just said that WHO does not really recommend refrigeration of blood, yet time taken for screening is as from 6 hours. Is that doable? Okay, thank you, Nancy.
Come again, Fred. The first question was why is?
Lipemic blood.
What?
Lipemic blood.
Lipemic.
Yes.
Blood, not safe.
Yes.
Mm-hmm. And the second one?
Yes, and then the other one was, you've just said WHO does not really recommend refrigeration of blood, yet time taken for screening is from 6 hours. Is that doable?
WHO does not recommend refrigeration of blood.
No, okay.
Yeah.
I think Nancy is referring to one of your statements, and she's saying you have just said that WHO does not really recommend refrigeration of blood. Yet, time taken for screening is from 6 hours. Is that doable?
Okay. Now, I think I start with that one. I don't know where I say that. If I say that, I think I say WHO recommends voluntary non-remunerated blood donors. Okay. So refrigeration of blood, that is a cold chain activity that must be undertaken. So if you want to prepare blood components, they must be done within 6 hours. That is either platelets or plasma. That is the current recommendation. So it means that blood will therefore then be refrigerated as soon on or before the 6 hours. If there will be no probably issues of platelets, then you can refrigerate the blood within the 30 minutes because there are some professionals that say the 30-minute interval before storage is essential, and there are others which say it's not. But for me, I say it's essential to have your blood outside for 30 minutes, and then you can refrigerate if you are not going to prepare components. Now, for lipemic blood, I think that, as you say, definitely the blood has elements of lipemia, and of course that would probably interfere with your patient, and we need to investigate the cause of lipemia. So yes, any blood that has any safety concern should not be transfused. That is probably what I could say.
Thank you, Doc. That's very able of you. I think there is another one from Samuel Sande, and Sande saying, greetings. What is the current status of Damu Sasa or Damu Kenya? And then Michael Osanya, when donating, a client starts to sweat, and okay, what could be the reason and what do you do?
first one is what is the situation with Damu Kenya and Damu Sasa? Of course, we are still restructuring KNBTS inside the framework of the Kenya Tissue Transplant Agency. So Damu Kenya, Damu Sasa is still a work in progress, and that is alive. So we are hoping that with the restructuring and with the one of our own at the helm, we can be able to make it work better for us. So we are hoping that it can actually progress beyond where it is currently so that we can use it more effectively. On the issue of the donor, of course, there are many aspects of donation or pre-donation we call effects, and some of them include sweating, perspiring. This means that we either cancel this one, and that's what we are talking about pre-donation counseling. We cancel them, we let them rest, and if they are still hyperactive, we can defer them temporarily so that because you cannot gainsay the fact that people have fear, and fear of the needle, fear of even the blood, fear of the unknown. These are normal things that happens, and so it is essential that we either cancel them, and if they are okay, they can donate. If they are still not okay, then we can defer them. Okay.
Thank you for that. I think you have covered pretty much all the concerns that were here. And unless there's someone with something that is burning or a question that you feel has not been attended to, you can either raise your hand or just type on the chat box. But I think so far so good. And also thank you for your compliments, a lot of them in the chat box. And maybe we may not be able to read all of them, but we can do that next time. Otherwise, I think it was a very, very wonderful presentation, Daktari. And maybe I'll take this back to you for your closing remarks.
Thank you, Fred, and thank you, colleagues, for all your concerns and goodwill. And I am hopeful that we can do better in our blood collection. I am hopeful that we can do better. And I just want to say that safe blood starts in the community way before donation, and we must engage our community out there so that we can get safe blood. I also want to say that as laboratory professionals, we are key to quality in blood donation, and we are key to ensuring that ethical processes in the blood donation. Otherwise, I'm hoping that you can have an ethical week. I'm hoping that you can have an ethical afternoon, and that we can have ethics embedded in all that we do. Thank you.
Thank you very much, Daktari, and thank you for reminding us that we should strive to ensure a safe and sustainable blood supply. And I'm sure that all of us were able to learn. And also, I think I've also learned that pre-donation testing and even the counseling are not just regulatory requirements, but they are ethical responsibilities for all of us, because they protect the recipients from harm. It will preserve donor dignity and also strengthen the confidence in our transfusion services. I think this was very, very much timely, and I think I think one thing that resonates with all of us is that our labs are not just testing centers, but we are silent guardians of patient safety. So let's try and put in practice whatever we have learned. Let us screen wisely. Let us continue to counsel compassionately. Let us test. We usually say we test meticulously, and let's save lives confidently. Thank you and enjoy the rest.